Assalamu alaikum and welcome to our today's presentation. Today we are going to discuss a group of antibiotics which act against bacteria which causes infections in our body, and this group of antibiotics is called fluoroquinolones. This group is uh, of antibiotics is a bactericidal activity and act by inhibiting the enzyme DNA gyrase and topoisomerase 4 in the bacteria, preventing their DNA replication. These are broad spectrum antibiotics. It means they act against gram positive as well as gram negative bacteria. They are well absorbed while prescribed orally, and they have partially hepatic metabolism. Bioavailability is 50 to 85%, and time to peak on oral administration is 0.5 to 2 hours. While talking about their excretion from the body, they are excreted through urine from 30 to 50% and through feces from 15 to 43%. This group of drugs is divided into four generations. Ofloxacin and nalidixic acid is included in first generation, while ciprofloxacin is a second generation of drug. Levofloxacin is included in the third generation, while in fourth generation, moxifloxacin is the drug. While talking about the indications and contraindications of this group of antibiotics, I should first describe the contraindications because these are the conditions in which these drugs should not be prescribed. And these conditions are pregnancy, lactation, children under the age of 5 years, the patients having QT interval prolongation, significant bradycardia, heart failure, and the patients with reduced ejection fraction, the patients with liver impairment and infection with methicillin resistant Staph aureus. These drugs are ineffective. Indications of this group of drugs includes lower respiratory tract infections, skin and soft tissue infections, intra-abdominal infections, bone and joint infections, urinary tract infections, otitis media and otitis externa, while they are also helpful in sinusitis and also used in gonococcal urethritis, cervicitis, and pelvic inflammatory disease. They are used for the treatment and prophylaxis in the patients with neutropenic crisis and also used in inhalational anthrax. These drugs should be prescribed with some precautions, and these are that there is risk of arthropathy in children and adolescents, and if there is history of tendon disorder or renal impairment, these drugs should be prescribed precautiously. There is also a risk for the prolongation of the deep venous thrombosis, and while using these drugs, exposure to the ultraviolet rays should be avoided because of the development of the photosensitivity. And the patients with a history of seizures, myasthenia gravis, acute myocardial infarction, and QT interval prolongation, drugs should be prescribed precautiously. While using these drugs by the patient should have advice that it should be taken with or without meals, avoid taking these drugs with the dairy products, and should take these drugs 2 hours before or 6 hours after antacids. While using entire coated tablets of these drugs, do not crush or chew these tablets. There should be complete full course of therapy of antibiotics even if the patient is feeling better, and use of the caffeine should be limited while using this group of antibiotics, as all antibiotics have some side effects. So let's discuss some adverse effects of these antibiotics. These are nausea, vomiting, diarrhea, headache, dizziness, insomnia, skin rash, abnormal liver test, acute hepatitis, hepatic failure, photosensitivity, QT interval prolongation, hyperglycemia, and hypoglycemia. They may cause damage to growing cartilage and cause arthropathy, and they can cause also tendinitis. While discussing about the dosage schedule of these group of drugs, the doses is based on the presentation, type, and severity of the infections. The most common dosage schedule which is being used in our community are ofloxacin 200 to 400 milligram once a day in the morning or 400 to 800 milligram in two divided doses for 5 to 10 days. Nalidixic acid 500 milligram to 1 gram 4 times a day 7 to 10 days. Ciprofloxacin 250 to 750 twice a day for 1 to 2 weeks. And in adolescent group from 5 to 17 years of group, the dose is 20 milligram per kilogram twice a day. While in patients with the bone infections, ciprofloxacin is used for 4 to 6 weeks. While using IV infusion, the dose should be 400 milligram twice a day for 1 to 2 weeks, while in bone infection from 4 to 6 weeks. Levofloxacin is prescribed in the doses of 250 to 750 milligram once daily orally and IV for 7 to 14 days, while moxifloxacin is prescribed in the dose of 400 milligram orally once daily for 5 to 10 days or 400 milligram IV 5 to 10 days once daily. While using these drugs intravenously, it should be prompt that the IV infusion should be used over the period of 60 minutes due to the development of drug oversensitivity and drug-to-drug interaction. Drug-to-drug IV incompatibility means that these drugs should not be used with the following drugs to avoid drug-to-drug incompatibility in the same IV lines or in the same syringes. These drugs are acyclovir, aminophylline, ampicillin, sulbactam, azithromycin, furosemide, heparin, hydrocortisone, lansoprazole, magnesium sulfate, methyl prednisolone, pantoprazole, phenytoin, piperacillin, tazobactam, propofol, and warfarin. I think this presentation was very helpful for the patients and also for the medical professionals. You can follow us through social media and also from web. Thank you very much.